Okay. I want to first start out with sharing a personal story with you. 3 years ago, I experienced really severe back pain, and this was caused by being a gymnast for 10 years. And so finally I went and had my MRI, and what I found out was that I had 4 bulging discs in the thoracic region of my spine. So what a bulging disc is this little red bulge right here. It's when your intervertebral disc will actually bulge out and press on your spinal cord, which causes pain, obviously. Because your discs are like a jelly donut. They've got fluid on the inside, and with injury, that fluid will want to push its way out, and when it does, it pushes back onto your spinal cord, and which causes pain. Alright, so my name is Danielle, and I want to say that physical therapy has changed my life because it did help me with the pain that I was experiencing when I had the bulging disc. And I became so interested in it after my treatment that I went and got a job in physical therapy. So today I want to talk to you about what physical therapy is and the effects of physical therapy, positive effects that I've experienced. And I want to teach you a little bit about the different treatment modalities that physical therapists use when you are in treatment. So what is physical therapy? It is a medical treatment option that is used when someone's experiencing neuromuscular or skeletal problems, and it helps regain movement and function. People usually go see physical therapists after they've had a surgery or an injury or a life-threatening injury like a stroke. Someone will go to like a speech therapist because they've lost a lot of the ability to speak and other things. So physical therapy also goes hand in hand with fitness training, and you can go to physical therapy now for golfers. Here we all live in the Coachella Valley, so we know that golfing is a big thing out here. So there's a lot of therapists that just are for golfers. They'll improve golfers' swing and strengthen the muscles that help with that kind of thing. Same thing with tennis. So that's very interesting. Now I want to talk to you about the positive effects of physical therapy. What it does is strengthen muscles. So the more your muscles are strengthened, the less pain you will have. So when your muscle strength diminishes, your muscles hold up pretty much all of your skeleton. So when that's gone, you're going to have pressure, which causes pain on different areas of your body, joints, and also it increases your range of motion. Say you have a surgery and you're on your knee, and your knee swells up. You can't bend your knee all the way because it's so swollen. So physical therapy helps with that. People also go to physical therapy to help with balance. People want to move away from a walker or a cane, constant use of that, and balance training is provided from physical therapists. And the #1 reason probably is pain relief. Although treatment can be painful, in the long run it should help. And it is a good alternative to pain medications because those, as we all know, can be very addicting, especially, they tried to prescribe me painkillers when I had bulging discs, and I was 15 years old, and that's really scary for my mom, especially because she didn't want her daughter to be addicted to painkillers at 15. So they also provide education for physical training that you could take with you for your whole life. If you stay in really good shape, you're going to be healthy your whole life. Next, we'll go into modalities of physical therapy, what you would do at physical therapy. Really common is electric stimulation. What it is an electric current that stimulates muscles, and that increases blood flow to the area. So I'm going to make my arm
Twitch.
twitch for you.
Shock and fall off.
No control for that. So that's how it works. It really increases the blood flow to the area, and that helps repair any injury in there. Blood flow always is good. Second, there's also ultrasound, which is not the ultrasound we usually think of when a pregnant woman goes and has a picture of her belly. It's therapeutic ultrasound, so it uses high and low wave frequency to enter deep. The waves go past the nerve, so you don't really feel much, maybe a deep heat when they're doing it, and this helps increase blood flow, releases muscle spasms, and it'll decrease swelling. And also physical therapists will usually use hot and cold pads. The physical therapy where I work, we use cold pads because after we've done exercise and stuff with the patients, their muscles usually do get a little inflamed, and I like to bring it down with some ice. Soft tissue mobilization is actually really popular as well. There's a picture of soft tissue mobilization on the ankle. And it's also called myofascial release. What it is, it's kind of like a deep tissue massage, and it loosens up the fascia, which is a fibrous layer that surrounds your muscles. And when that's tight, obviously your muscles are going to get really tight, and that part does tend to hurt because the therapist will really, work with the patient to bend a knee or release the muscles in the back, and that can be painful, but in the long run, like I said before, that it should help you. And also exercise. There will be a treatment plan for most patients who go to a physical therapist, and that way you can strengthen the muscles around the injury. For instance, people with knee injuries, you want to strengthen the quad up because that helps bend the knee, and without a strong quad muscle, you're not going to have strong knees, and you're more likely to have another injury. So you will receive a treatment plan. North Carolina Baptist Hospital did a study, and they came out with patients who received an exercise plan got out of bed 5 days before patients who received no exercise plan. And Dr. Peter Morris from that hospital is quoted saying that we've shown that there is a measurable benefit to physical therapy in the ICU environment. So it is working. Today we have learned that physical therapy can be effective. We've learned what it is, and we've learned about the different therapy that can be done there. And many people do benefit from it, and I hope today, after you've heard all of this, you will consider it as a treatment option. Thank you.